Okay, so we're going to build off the skeletal system. We went over the basics last time. And I'm sure you have seen around Halloween time the costumes that people have, or the outfits people have with the skeletons, you know, some sort of black jumpsuit may look something like this. Well, I'm sure you've noticed that some of them are not anatomically correct. And hopefully, after studying this a little bit, you'll be able to, you know, point out to some of these people, trick-or-treaters or whatnot, the many inaccuracies of such ridiculous costumes. For example, this couple here, have some of the parts, but I'm pretty sure those ribs are missing a sternum for that guy. And of course, this is cute, but clearly not a functional skeleton. So we'll start by going over the axial skeleton, which is aligned along the axis or middle of the body. The skull then is the, of course, part that protects the brain case, and many of these bones are protecting then your vital organs. The vertebral column is then protecting your spinal cord. Thoracic cage is protecting your lungs and heart. The hyoid bone is in your neck, and our ear ossicles are very important to the establishment of sound waves, or the perception of sound waves. And I have vertebral column in here twice just because I made a mistake. All right, so the functions of the axial skeleton forms the longitudinal axis, so yeah, from superior to anterior, and supports the neck, head, and trunk, and protects the brain, spinal cord, and organs in the thorax. So again, protecting those vital and some non-vital organs. We're going to start then with the skull. The skull has 8 cranial bones. Some of them are paired and some of them are not. The frontal bone is the big forehead bone there. It has one of those. 2 parietal bones behind it. You can't really see on this figure. You see on some of the other ones. The occipital bone in the back. And the temporal, sphenoid, and ethmoid. Temporal on the side, sphenoid and ethmoid on the inside. So here you can see the occipital bone and the temporal bone. The temporal bone also goes up along the sides here. And on the next one, you can also see on the interior of the brain case, the sphenoid bone here and part of the ethmoid bone here. The skull also has facial bones, 14 of those, including the mandible, which forms the lower jaw, the vomer, which you can see a little bone right here, the maxilla, 2 paired bones, which you can't see on these. Oh yeah, these you can see over here. The palatine bone, which forms the back of the palate, the zygomatic bone, which is part of the zygomatic arch, the lacrimal bone, which you can't see on this one, but is what forms or holds the tear duct, the nasal bone, which is supporting the cartilage of the nose, and the inferior nasal concha. These are inside the nasal part. And let's see, let me go back so I can show you some of those. All right, on the front here. So you can see the nasal concha here on the inside. Here's the nasal bone. Here's the lacrimal bone right here. The maxilla and our zygomatic bone here. Okay, so those are the bones of the skull. The functions of the skull are form the framework of the face, right? We do a lot of things with our face. It holds the cavities for our special senses, including hearing, sight, taste, and smell. It's our opening for air and food passages. It secures our teeth. Our teeth are embedded within skull bones, okay? And it's the anchor for muscles that we use for facial expression, which are very important for communication. Sometimes our bones, which are holding our brain, can get rattled a little bit, especially in contact sports such as football or rugby, or in sometimes just incidentally in other non-contact sports. But this may form a concussion, where you have an alteration in brain function due to some sort of permanent neurological brain damage. Essentially, you get bumped, you get rocked, and your head hits something, and the brain slams up against the brain case, and that can cause then permanent damage to that part of the brain. If blood vessels rupture, you can have a hemorrhage, and it can swell and can be fatal, because if the brain swells, there's not room. The skull bones are not meant to flex very much, and thus that pressure can lead to death. Acute responses or acute concussions can cause nausea, loss of consciousness, amnesia. You may also experience loss of sight, depending on which part of the brain was damaged, loss of other senses, and those are maybe temporary but sudden symptoms, thus acute. Chronic would be longer lasting ones, such as headaches, sleep problems, fatigue, and or mental illness. So concussions are a real thing. Many sports take many precautions to prevent them. The rules of football are constantly changing to prevent them. However, they're still going to occur because you're slamming people against each other at full speed. Our brains develop in an interesting way. We don't have complete ossification at birth for these flat bones. Instead, there are some areas between the bones in which you still have cartilage or fibrous sheets, fibrous membranes, and these are called fontanelles. There are a number of them, and you can see them in their figure there. And this allows the baby's head to compress during birth, so that, if it was just a rigid structure, the birth canal is a tight space, and it could, cause damage to the bones. But since they are somewhat flexible with those fibrous joints, they can be warped and manipulated and form what's called a cone head. I'll show you pictures in a second. The anterior fontanelle then is the least of, or the last of these to fully ossify, which is the soft spot on the top of your head. Most of these others will ossify, within the weeks and months after birth. But that last one takes 2 years to fully ossify. And again, this birth canal, the constrictive part of birth is that head. The head is the biggest thing that has to get through. And so any sort of manipulation or constriction to allow it to fit that canal and fit through it is going to help the birthing process. But this can sometimes result in this weird squished head phenomenon called cone head, which is temporary. Eventually those bones will shift back into place and form a nice round head. But vaginal births will often, and if it's very long, if the baby's stuck in the birth canal for a very long time, then that misshapen head can be more pronounced. All right, so that's the skull and brain case. The hyoid bone is the only bone in the body that does not articulate with another bone. But it is important. It's the origin for tongue muscles, the tongue muscle, and it has attachment for other things around the throat and jaw and cartilage there. It does offer some protection, and in fact, when a person is strangled to death, one of the signs is this bone is broken or damaged in some way. The ear ossicles are 3 small bones found on the middle ear, in this area here, and they are the malleus, incus, and stapes. They look like a hammer, anvil, and stirrups. That can kind of help you remember those names. They develop from the first and second pharyngeal arches, which are embryological structures, which then develop into cartilage and then develop into bone. These act as a lever system to amplify the vibrations from the tympanic membrane or eardrum, which then can be converted into what your brain perceives as sound. All right, so the ear ossicles, then we're going to move on to the vertebrae. There are a number of different types of vertebrae. The first type is the cervical vertebrae found in the neck, and there are 7 of those, and they are named by their type of vertebrae and then in what order they fall from closest to the head to furthest away. So C1 through C7 are the cervical vertebrae. The first is C1 and is often called the atlas, and the second is C2 called the axis. They allow for head and neck movement up and down and left and right rotation. The thoracic vertebrae are ones that have connections to ribs, and there are 12 of those. Lumbar vertebrae do not have connections to the ribs and are in the lower back. This is often the site for back injuries. The sacrum is sacral vertebrae are part of the fused sacrum, so these are all connected together and form a large bony structure that the hip bones articulate with. And finally, the coccyx is the tailbone. Pretty useless 4 fused bones that just sit on the end there. And we don't have a tail, we don't have an external tail. Sometimes it is called the bird's beaks. It kind of looks like a little beak sticking out there. All right, our general anatomy of our vertebrae, as we learned before, they are an irregular shaped bone. They have this large spinous process coming off the mid-sagittal line, and it points posteriorly, so towards what would be your tail. It has transverse processes coming off the transverse plane there, lateral projections. Has a central canal, which is bony, and central canal, which is where the spinal cord sits, and then the centrum, which is the bony part, which is the structural component. And then they'll have vertebrae in between adjacent centrums, and all these processes and different projections are for muscle and nerve and blood vessel attachment or passageways. All right, the cervical vertebrae, again, are the neck vertebrae. They have holes in their transverse processes. So you can see one here. Here's a transverse process hole here, and that's one of their defining characteristics. The first one, like we said, is the atlas, and it has a superior articular facet, so the part that touches with the next part above it, right here. That articulates with the occipital condyles, which are on the skull, on the occipital bone. The axis is C2. It has this odontoid process or dens, this large projection here, and that fits inside the atlas, and surrounded by this ligament then allows for lateral movement from side to side, rotation of your head from side to side. It does not have a transverse foramina, transverse hole, at least not very big ones. There are some labeled here, but many of them you'll see those will be ossified already. The thoracic vertebrae, again, they have a very angled spinous process. You can see here, angled down. All of them articulate with the ribs. The head of the rib articulates with the superior and inferior costal facet, and the tubercle of the rib articulates with the transverse costal facet. So here's a superior costal facet. Here's the articular facet, and so the head and the neck will articulate there. Lumbar vertebrae, they have very short spinous process, kind of looks like a hatchet. If you look at it on the side, kind of looks like a moose. I'll show you a picture in a second. The sacrum then is this completely fused group of bones here, and they have these holes called sacral foramina for nerve and blood vessel passage. And finally, the coccyx is 4 fused vertebrae, kind of beak-shaped, does not have any holes, just really a vestige of evolution having a tail. It can be broken, which is not good, feels bad, and you have to sit on this donut for a while if you have a broken coccyx. All right, so here are some vertebrae to give you a little quiz. This, as you can see, has the transverse foramina, so it is a cervical vertebrae, specifically the atlas. Here it has, this is actually not human, but this is actually a lumbar vertebrae, so I was just wanting to trick you. This, you kind of see, it looks like a moose. Right? This is a human lumbar vertebrae. I wouldn't give you anything like this on the test, just so you know. Okay, here is 5 fused bones. 1, 2, 3, 4, 5. This is a sacrum, core sacral vertebrae. Here you have the large dens, or odontoid process. This is our axis. Here is another cervical vertebrae. You see the holes there. And finally, this is a thoracic vertebrae. You can see the places where the ribs would go. And also, it kind of looks like a giraffe. Okay, so thoracic kind of looks like a giraffe. Lumbar kind of looks like a moose. These guys kind of look like weird spaceships. Okay, the spine, as you know, or may have noticed, is not perfectly straight. Okay, it has a curve to it, and in fact that curve changes over developmental time, starting when you're a baby. The spine of infants is actually pretty convex when you look at it from behind, pointing out towards you, and the whole thing is, and this is very similar to a cat's spine. It has to do with their positioning of being on 4 legs. As an infant develops, however, the first part that develops a different curvature is towards the neck when a baby learns to hold up its head. And it starts to curve in the opposite direction. So we call that the secondary curvature, and the original curve is the primary curvature. Well, so after it learns how to hold up its head, it really has a spine very similar in shape, with primary curvature at the cervical vertebrae, secondary curvature at the cervical vertebrae, and primary curvature everywhere else. And that's typical of how babies also are able to move around. So they walk on all 4s, similar to a cat. Eventually, however, the secondary curvature forms during the lumbar curvature in the lumbar vertebrae, and this is when an infant learns how to walk. So that secondary curvature there then allows for more support towards standing upright. And so primary curvature is, again, convex, looking from behind, and secondary is concave. We have 2 secondary curvatures and 2 primary curvatures. All right. Secondary curvature first develops with head muscles, and second with walking muscles. Well, sometimes they don't develop as they should, or there may be some sort of developments which can cause the spine to be shaped abnormally. And there are 3 of which we're going to talk about. Kyphosis is an exaggerated humpback, you see that in the middle here, where there is an excess of primary curvature. Okay, this generally happens in older people, but can happen due to injury or other things as well. Or bad posture. Lordosis is an exaggerated or swayback, where the primary curvature is increased in the lumbar area. And this generally happens when a woman is pregnant to counterbalance the giant swollen uterus, which forms a nice pregnant belly. The third one is scoliosis, and this is where you have lateral spinal abnormalities, okay? And that generally has to have some sort of treatment. You can do exercises and stretches and strengthen the muscles if it's minor, but if it's greater than 25 to 30 degrees, it may need a back brace, and over 45 degrees, it's going to generally require surgery. I do know someone who's had this surgery. Basically what they go and do is put in some straight metal rods and adhere the vertebrae to the metal rods with some screws, leave it in there for a while, and then afterwards take those out. And it is critical that you catch this at a young age and get treated for it so you don't have to go to these very invasive surgeries. And that's why it is done in school. All right, ribs are our next group of bones. There are 24 ribs, 12 pairs, 7 of which are true ribs. That means they have their own cartilage, which touches the breastbone sternum here. There are 4 false ribs, 8 to 12, I guess that would be 5, 8, 9, 10, 11, 12. And they do not have their own cartilage. So you can see these all here, these 3 share a cartilage. Okay, or this one kind of has its own. These 3 are sharing a cartilage into that same connection. They're called false ribs. And 11 and 12 here also, they don't even have cartilage, so they're also false ribs. And they're also called floating ribs. Okay, so these 3 are false. These last 2 are floating ribs because they don't have any cartilage. As mentioned before, the head of the rib articulates with the superior and inferior costal facet of thoracic vertebrae, and the tubercle of the rib articulates with the transverse costal facet, and it fits in just like this. All right, so that's the axial skeleton. We're now going to move on to the appendicular skeleton. Okay, and we're going to start with girdles. Girdles are basically attachments between the limbs and the axial skeleton. So the first girdle, starting up near the shoulder, is the pectoral girdle, which includes the scapula here and the clavicle here, or the this is your collarbone, forms your collar. And this attaches to our left and right appendages or arms. From there goes humerus, radius, ulna are together. The carpals, metacarpals, and phalanges. The pelvic girdle then is the group of bones that ties your legs to your axial skeleton and includes the coxal bone, which is actually 3 bones, ilium, ischium, and pubic bone, and then attaches to the right and left legs. From there you have the femur, largest bone in the body, the tibia, and the fibula together, then the tarsals, metatarsals, and phalanges there, which are your toes. The sacrum and the 2 hip bones together form what's called then our pelvis, part of the pelvic girdle. And these vary or are characteristically different depending on whether you are male or female. Males have long and narrow pelvises, and the legs generally sit right under them. And their pubic arch, which is this part here in between the 2 pelvic bones, is less than or about 90 degrees. And the obturator foramen, which is this hole here, is round in shape, whereas females, they're short and wide. This birth canal here or pelvic brim is more circular. Pubic arch is greater than 90 degrees, and their obturator foramen is oval in shape. And this, the females are better suited to have a small human fit through there, which is important. Males, of course, are never going to have a baby, so this shape is much less important, and the structure actually of it allows for men to be mechanically better able to run. Like, it's better to have your legs right under you for running speed and length and longevity and everything else. So when you look at them side by side, or even by themselves, side by side you can definitely tell, but by themselves you can look for these characteristics to determine whether it's a female or male pelvis. This is a female pelvis. You see that angle there is larger than 90 degrees. Here you have a male on the bottom, a female on the top. This one is a plaster pelvis, so it's harder to tell, especially because this may not be in its original shape, but it looks like that's pretty close to 90 degrees, so I would venture to say male. And then here we have a male and a female side to side. So here's a wider and shorter female pelvis here. This is more oval. This is more round, longer, and skinnier. This is your male pelvis. All right, from there we got the bones of the lower appendage, including our femur, which is the largest and strongest bone in the body. The tibia is the second largest and strongest bone in the body, right below that. The acetabulum is the point, or the socket then, where the three coxal bones come together and form where the head of the femur goes into the hip joint. The foot and hand bones are pretty similar. They have a bunch of smaller bones in the wrist or in the ankle. In foot bones, they're called tarsals, and in the hand bones, they're called carpals. And then the bones from there, so here's your carpals. Within the hand are the metacarpals, and then the three bones which form the fingers are the phalanges. The thumb has a specific name as the pollex. The big toe has a specific name as the hallux. And you can see it follows the same pattern here as well. The tarsals, metatarsals, and phalanges. There are some of course problems which can arise from using the hands, the muscles, bones, ligaments too much, including carpal tunnel syndrome. The carpus is a structure formed by these bones which sit in your wrist, okay, your carpal bones here, and a ligament which is above it. Now, running through or across the carpus is the transverse carpal ligament, and then through them is nerves and blood vessels, including what's called the median nerve. And what can happen is damage or overuse of the hand and the wrist can cause swelling of that ligament, and that swelling and inflammation can then cause a loss, affect that nerve, which can cause tingling and pain in the hand. The treatment for it the surgery is to just go in and cut that transverse carpal ligament. But before you do that, that's kind of an invasive surgery. Actually, they have it where it can be a lot less invasive. But you can use stretches or brace or exercises to loosen up that area and prevent the inflammation. But if not, then you may have to do the surgery. All right, and that's it for our axial and appendicular skeleton.